Good morning, everyone. It's May 15th, 2020, and we will call our special Wright County Board meeting to order. We'll begin with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Thank you, everyone in attendance and joining us remotely. We have 4 commissioners in-house and Commissioner Burrell remotely this morning. So, our continuing discussion on COVID-19 and how to move forward with our changing directives from the state, and also figuring out how we as Wright County government departments are going to proceed and work toward opening. Administrator Kelly, you sent out a preparedness plan for Wright County and gotten some feedback from staff and department heads and
yeah, it's very much a work in progress. I don't know how many different drafts administration worked through before the one I most recently forwarded today. I was hoping to get your feedback on that in the next couple days, as we will have, I was anticipating the final would be brought to the board on next Tuesday's meeting. So as you know, we've been working on plans as we look towards the face-to-face contact with public again. We've had our phase 1 in place now for a few weeks. I think we were maybe anticipating that the governor was going to extend the stay-at-home order at his last press conference, when that is not what took place. So, you know, that kind of threw us a little bit of a curve. I think to some was surprised to see that, but at the same time, I think there's positives that can be brought with that too. So, I guess the discussion today, knowing that we were planned to be closed or remain public counters being closed through up to the 18th, what our next thought would be as far as resuming face-to-face contact and serving the public. So I guess that's one thing I kind of wanted to raise, that I hesitate to use closed because we've had our lobbies open and the ability to do services through different forums as far as drop boxes, calling in, some things online. So to me, it's a discussion of when are we moving more towards the resuming of face-to-face contact with our departments. So as I mentioned at the workshop the other day, there are a few things in modifications that we're still working on. We had some lead time with some people building a window for us and a few other things, so waiting on a few of those, but we have a fair amount done. You may have seen some of the distancing stickers that were applied at the lobby. So just a few of the things we've done, and I don't know if you have specific questions on that, and I can respond to that as well. So
yeah, I think that raises some awareness for people. I think people have generally speaking, been pretty good at doing the social distancing in places I've noticed. Mm-hmm. Not all, depending on where you are, but that's a reminder too of, well, that's how far away it is. So, but as far as the plexiglass, the sneeze guards, and that kind of thing, when realistically is that? I mean,
we have a few of those that are yet to be deployed. We have the majority of the departments, public counters covered on that sense. I think the biggest challenge that we're working on right now is the queuing, given the governor's guidance of not gathering more than 10 people. We've had a lot of discussions of the best way to manage that, knowing our biggest influx of people coming in on reopening is likely going to be for driver's license services, the DMV. And so one thought on that is to, we've talked about using the east entrance as the primary for that. As I mentioned, we're working on the window for that, and we have some different queuing and such planned as far as the velvet rope kind of a deal. But the challenge is, that's one way to approach it. We could put folks in the lobby to manage the line, or we could leverage appointments as another option that's been thought of. But each has their pros and cons.
One thing about where the DMV is in planning and zoning, I don't think it's good to have, as we've had in the past, the line that's, all the way to the elevators
Correct.
sometimes. And that wouldn't be, a good deal. But I can see that if you had, it's kind of like, okay, only so many people are allowed in this particular building right now. So when one person leaves, then the next guy can go, kind of thing.
Yeah, but
So I
that
don't know
means
if you had something like that in the lobby.
we'd have to have 3 people at the doors and,
No, I don't mean that. I mean, I think you could do that with signage, but
See,
maybe not.
One of the things that I'm thinking is that because there's gonna be a bottleneck right off the start.
Right.
So if we temper it and say, we pick a date of 1 week, whether it's May 27th, we're gonna open up the assessors, the recorders, and HHS windows. And then the following week, we'll open up, say, the extension P and Z window, and then the following week, you open up DMV. So hopefully you get a period of time where some of those P and Z people get through there, so they're not gonna be standing there, it's not a mad rush to the P and Z window and the DMV window at the same time. I would hope to open the P and Z window for at least 7 to 10 days before we'd open up the DMV, so that hopefully we can get some of those people in and out of here before we mad rush the DMV.
Unless it's the other way around, and we open up DMV, get,
that ain't gonna ever be.
people.
No, that'll never go away, that'll be
I
that
know-
way
I
for
know-
months. So
I
I
know
think,
it won't
because the
go
P
away,
and Z,
but-
we can maybe get 20% of them that maybe will just come in that 7 or 10 day window, and we can get them at least down to a slow trickle.
Sean, do you think there are many people out there that have been holding back because they haven't been able to go directly to the window?
No, they've been pretty busy.
I know you've been busy, and that's why I'm just curious if you think you'll see a
Right, Mr.
announcement.
Chair, County Board, I don't think we've had a lot of holdback because this is a seasonal thing we deal with, building houses and putting in septic systems and selling property, and we've kept up. I don't see a big rush, and anybody that's uncomfortable to come in initially, we will take care of through alternative means. Our issue is when the gate goes up, my expectation is we should be providing them a different level of service than we do now. To open the gate and have people come to our counter and tell them, you can't meet face-to-face with our staff because they're not here, and you need to call them, and you need to email them, and you need to leave a message for our building inspector, I don't know how well that will go over. What's the reason to open the gate for the public to come in to not be able to meet face-to-face with the majority of our staff if we're still having them social distance and try to, avoid congestion issues in the office by having staff to a large degree to still not be there. We can handle either way. If our gate is closed, we will provide all our services. If it's open, obviously we'll provide all our services and deal with people at the counter. I'm just hesitant to be in that dynamic of still telling people, our planner or our feedlot officer or one of our building inspectors, our solid waste officer, whoever, is not in the office to directly deal with you face to face.
But I don't know that we are going to be able to, to some degree, this is just not possible for us to say this could go on for 6 months with these type of parameters. And I'm not going to say that we're going to have people, at some point, everybody's going to be in your office working. It's just.
Right, so I would agree with you, Commissioner, that at some point the gate has to go up. I would ask for at least another week because we're still doing some things, if not 2 weeks. So at some point the gate has to come up. My point is then that's going to lead to, at some point, staff, whether it's rotating, taking measures in the office, will have to come back to the office to a larger degree than what we have now.
And with the staff that I've talked to, just so I'll show my cards, I was not in the inclination that we're anywhere prepared to open up next week. No. So I'm not expecting to open up next Monday, Tuesday, or at all next week at all. I'm not inclined to ever open up on a Monday or the Tuesday after Labor Day, because if any day that we would open would be midweek, because I want to give department heads time.
Memorial Day. I'm hoping you're not waiting till Labor Day.
No, I'm sorry, Memorial Day.
I didn't even catch that.
I don't want to open up on 8 o'clock on
Tuesday after Memorial either, because I need to give you guys a day to work with your staff and get them prepared for opening up. So, you know, I threw out dates in my mind. I'm like, okay, my soonest date would be Wednesday, May 27th. My latest date would be Thursday, June 4th. And whether we open some on Wednesday, May 27th and open more on Thursday, June 4th, you know, in DMV, in my mind, being one of the last ones, because we still have a lot of components that we need to put in place for that to happen.
Right, and I mean, certainly Becky can probably speak more to this, but when if we change the flow where they're coming in, you know, and I don't know if they have to wait outside with, you know, umbrellas, because it might be bad weather or whatever, but that might just be the best solution, and that would open up the hallway for people. And there's people that are not going to be comfortable coming in at this point, and you can still, you know, work with those people, and as you've been doing for the last 2 months. And I mean, every department has their, you know, they've been able to take care of the needs of our public as best we can.
It's obviously if a person drives to the courthouse and walks in and comes up to your counter, they have an expectation. So I don't have an answer for this. Whether it's June, July, August, this fall, when will we be able to fully meet that expectation? But if we're going to have a department that is fully meeting or they're 80% meeting it, and another department, essentially most people are told, you need to email or call still.
Right, yeah, we do have to figure out a clear message. So how many people do you estimate a lot of your inspectors are out and about, they're not in the office?
This time of year, we have a lot of people out
Yeah,
anyhow. EHO, building inspectors, feedlot officer. I don't want to make this sound like the day the counter opens, we're going to have this issue, because we're coming and going anyhow. We'll manage it. It's more of a long-term 2, 3, maybe half-year type thing, that if we're having differences in staffing levels, this department, that department, I don't know if that'll introduce issues.
Madam Chair, I guess because I look at it from like your department, if we opened up, say, Wednesday, May 27th, your planners and your feedlot people, I mean, they're in cubicles, and, you know, I think we even put those glass guards in between the upfront ones that are half levels as well. So as far as being able to meet, I mean, we should be able to bring all of them back in right there and then at that time.
Yeah,
I mean, because the other ones are already going to be out of the office anyways, all
Right.
your building inspectors, so that's really no change in operations. So I look at it as if we open the gate, you should be able to meet everything that we did prior to closing it.
Well, right now, they're not there.
No, but as soon as, like, if we pick a date, I'm like arbitrarily say May 27th, they'd all be back in the office and we should be able to answer any questions that we were prior to this.
If that's what this document is indicating and that's the direction you give. So if those conditions are countywide, then
and,
probably has to be consistent, right?
right, I mean, I think if we're opening up our windows, depending on how we do that, if it's in stages or whatever it is. But at the same time, my belief is that departments have to make their decision of if someone, you know, can't come in, they
Underlying
can do their job from home or wherever they are, but for a certain time being, if they've been advised by their doctor or whatever that they shouldn't be in the building, I think that's something the board has to agree on, that everyone has to agree on. But I think that that's something that we need to look at, because if they're medically advised not to be, you know, close to people, and I think that you can certainly distance people in your office, even though your cubicles are pretty close together, but there is cubicles, so.
Yeah, and you're right, and we have those occasions that come up with individuals, and HR helps work through those as well. And also I'll raise, you know, the guidance is to continue to telework or work remotely as folks are able. And there's other strategies to distancing as well. You can also do different shifts earlier, one later to try and keep people. I know some of those discussions we've had in our office, knowing we don't have the 6-foot distancing with some of our workstations, so.
But it's a disability. I mean, ultimately, at the end of the day, if you have underlying concerns and you're worried about your health for it, and that would be considered some level of a disability, and we'd be required under the law
Right.
to have to make reasonable workplace accommodations for
Right,
them.
and I think, generally speaking, I mean, when you're walking through the building, basically, the one place where there's the most people is DMV.
No.
And the other, and department heads, better than any of us, and of course, I mean, you have a lot of clients with HHS, and, and of course, you're in probation and court services, you're out with your clients too, so you're making those accommodations, and you can also figure that out in your office. So I think that opening the public counters doesn't mean that instantly means everyone's back at the building. It means, let's take this in stages, let's be reasonable, let's be respectful for people's concerns and their ability or inability to physically be on site. But, I think the biggest thing is going to be at DMV, and that's going to be where we're going to have to figure this out, and they're working, I think, well on getting that outside window. It's just going to take a little while before that happens, so in the meantime, coming in from the east side might be the
Madam Chair?
best solution. Yes, Commissioner
Thank you,
Potter?
Madam Chair. On opening the public windows, a one size doesn't fit all in this situation because everybody has a different level of public interaction than you do. Maybe in P and Z, you can still have a limited staff there and have people, encourage them to make appointments or meet somewhere. Might not be so bad. DMV that animal is going to be the biggest nut to crack here. I'm understanding that window will be there in sometime in June.
Yeah.
So I'm thinking
good.
let's
good.
get that in first to help alleviate that, because that's going to be the mad rush, because all the people that have license expired, titles from out of town, all these other things. I know a couple contractors that need people coming with a hazmat deal. That stuff isn't happening right now, and it's not going to happen overnight either. It's going to take a while to get in there. But that window there is kind of important, because been encouraging, people have been liking it, and when I'm telling people with the new building with the drive-through for the tabs, they're thinking, oh, that was a great idea. But that's the area that's going to be the most difficult to figure out in this opening, because there will be a mad rush, because if other places are waiting and slowing down and we're open, they're going to all come here, just like before when they shut down for the Real ID thing. We had people from Carver County, Sherburne County, Stearns County coming here because they weren't open for it.
And for 2 years, we've had long lines, right, Becky?
Madam Chair, and I want to agree with your statement. I'm not saying that if we open the public window in your department, that all your staff have to be back here working. It's at the discretion of the department head to determine what level of staff they need to have on site to be able to manage the traffic that's going to come to your window because it is open.
Madam Chair, and regarding what you have, now is a great time to be looking at your personnel and saying, who do I have cross-trained? Because if you got one person that can only answer the questions, either you need to figure out something else to deal with that, or that person is going to be, if they ever left, what's going to happen? So you need to have that plan for the future too. And now is a great time to look at that.
And I think that's part of the continuity of operations.
Well,
also.
again, but that should not tell you, I mean, you should not have an issue with who needs to be in the office, because you should have a backup for everybody.
Right,
Right?
You don't want you don't want all your information to go out the door when that person leaves.
right.
So now's a great time. I mean, there's no reason why everybody needs to be in, because you have a backup.
Right.
And if you don't, then we have other issues to deal with.
Yep.
Well put.
Greg?
Madam Chair, Commissioners, so just so you know, I mean, we're kind of in a unique position as the Veteran Service Office. Our office is small.
Right.
So even when we do reopen, for us to conduct business effectively with the veterans and protect HIPAA, privacy, data information, all right? So even when the counters open up, I'm going to continue doing appointments as much as possible. I'm not going to allow walk-ins anymore, period. If you have a walk-in, you'll have to make an appointment because I can't, because of our office size and the way we have to do business and the interviews Steve and I have to conduct with veterans, I can't have them in our specific offices because they're too small. I can't maintain 6 feet of separation.
Can you
and-
go into the EOC? Are you,
I could, but then that entails, okay, now I have to disinfect the EOC every time I use it and stuff, and that's a potential impact to Seth if he ever has to use it to make sure that I cleaned it and everything. So I'd rather not do that if I don't have to.
How about if
As-
you use the old jail? There's a lot of room out there.
I'm fine with that.
Okay, there we go.
yes, oh,
Go ahead.
Commissioner Burrell, did you have a comment for Greg?
Yes, Madam Chair, thank you. I guess mine is going to follow, I was just going to say what Greg Picard just said too. But I would advise against just opening up the counters. I don't care if it's DMV, planning and zoning, anything. I think I would open up the counters, but it would be appointment only, just like what Greg just said, because we have not had this run through our county yet. I mean, and we will have cases that are out there, and it's going to make everything a whole lot different. I mean, we are not over any hump. All we did was postpone the hump. So if we go and open up, then we have to just go back and revert back. Whereas if we just did this by appointment only at this time, do appointment only for whatever, it might be a month or so, and see how it's going to play out. That way you can regulate it by the appointment. Whereas if you just open up the counter, then you're going to have to go back and say, now we're closing the counters. And I would rather not do that. I would rather take little smaller steps going. That's my comment. Thank you.
Okay.
You know, even if the counters are open, I still think doing things by appointment, I think are still going to be a much better way to control the traffic coming in here.
As much
You're
as
gonna,
possible?
you're gonna have people that are gonna come in, but if we get the word out there, starting now, that in 2 weeks or 3 weeks, whenever the governor allows us to do a little bit more, we will only do things by appointment, whether it be DMV and planning and zoning and veterans and whatever else the case may be. It'll at least give us some control over what's going on.
I don't know that we have a
Thank
good
you.
system to facilitate. I mean, I think all of them minus DMV will have a very controlled, soft entrance
Right.
into it, because a lot of people are going to continue to use the methods that they have been using to do business, and that may continue on for years to come.
We don't know.
DMV, we don't, either from the state level, even locally here, we don't have the mechanisms in place for people to transfer things without really being in person to some capacity. And that's where I look at it. And doing it by appointment, we don't have any way to facilitate that well.
Well,
You know,
We can encourage that, but
Planning and zoning has an appointment set up, a
But that's,
software.
but planning and zone, but you're talking a fraction of the number of people. I mean, you're talking 150 appointments versus 5,000 appointments. I mean,
You can't, there's no way you can do 5,000 appointments.
no, but that's what but I mean, that's the volume difference. I mean, you're talking
But
a couple
no,
hundred
there-
versus a couple
you don't
thousand.
have the bodies to be able to do 5,000 appointments.
No, that's what I'm saying, but that's where do we cut it off? I mean, because
Well,
that's where you're looking at the,
Anybody that, once the state allows you to start doing licensing,
Mm-hmm.
you just state, anybody that license have expired
Mm-hmm.
first. You don't mess with anybody that has a license that expires in June. You start with those that already have an expired license.
I mean,
That's a different world.
we have the
we're gonna be
ability to
living.
have that discretion in telling people who we will issue them to and who we won't when we open based on when they expire.
I
mean,
don't think you're gonna have a choice.
We've prioritized in other areas.
Okay, I mean,
You're not gonna have a choice. There's no way you're gonna be able to, we're living in a different world.
Mm-hmm.
There's no way in hell that you're gonna be able to do everything for everybody right away.
well, absolutely. I mean,
So then why not control what you can do? And saying, these people need to be our first priority, because they have a limited time.
So you can do appointments for just license renewals. And as far as, what about title transfers? It's gonna be Dropbox only? I mean, and what
I
about,
don't know. How
what
many-
about tabs? Is it gonna be Dropbox only still?
Yeah, I think Becky, I think
I don't,
Becky's the best person to answer some of these questions.
I know they're able to do title transfers, but in the Dropbox.
Well, and Madam Chair, if there's complication in title transfer, you could say we'll do title transfers on Tuesdays and Thursdays,
Or by
Monday,
appointment.
Wednesday, or by appointment. But Monday, Wednesday, Friday, that's the license renewal. You can make it segregate out the days too, is some way to help mitigate this a little bit. 'Cause I don't sure how
I
many
mean,
titles
we
are
all
backed
agree,
up.
there's no silver bullet to this.
It's not ideal,
Oh, God, no.
No.
but, you know, if you want to control, that's your options.
Good morning, Madam Chair and
Hey,
Board.
Becky.
I've had conversations with many of you, and you know that we are in a very horrible situation, because like Derek said, the bus is gonna come in, okay? They're coming in. I met somebody in the hallway just now that said, I heard you're open, I wanna do my driver's license. It's not due for a while, but I wanna do it right now.
See, I'm
So-
not due, and that's the thing, you're gonna have those people.
But we're also going to have the people that will understand about the appointments, because there are people, there are offices out there that are doing appointment only.
It's a different world.
I don't know that Wright County, who is part metro and part rural, can do appointment only, okay? What if my appointment people don't show up and I've just turned away 3 people and I have my staff standing there waiting for the next appointment? I think I have to have a mix, okay?
And you're gonna have people that are gonna just show up
They
without
are.
appointment, and then you can just tell them, we'll
But
take
they're-
you as we can.
They
But
are going to show up.
Sherburne County did it, find out how did it work for them?
So it's more like appointments encouraged or whatever?
Appointments encouraged, yes. I do need to let you, I've been waiting all morning for something from the DVS, and it came as I was walking out the door, of course. And it says, this is what it says in the memo that arrived this morning. Offices may open for over-the-counter and face-to-face services, provided they have a COVID-19 preparedness plan in place. Deputy registers and driver's license agents should email a copy of the plan to blah, blah, blah. Okay. Offices may continue to offer drop-off, curbside, mail-in services in addition to over-the-counter services. So we can keep up with that also. Offices that are closed are not required to open. Offices that wish to continue offering limited services only with no face-to-face may continue to do so. Offices are not required to meet the 40 hours a week requirement as a Minnesota statute, but we have to notify them and apply for a variance. The preparedness plan, obviously, you guys are all familiar with, that we do have to submit that as to how we're going to clean our office and how we're going to maintain it with the amount of public. With the changes that we have done so far and reversing our line, it means that I can have 3 people at the counter, okay, 3 staff, 3 customers, okay? I have spaces for, I believe, 5 in the hallway, 6 feet apart, spaced out. Rest of them are going to be, there's going to be 1 spot out in the little lobby, 1 spot at the door, and the rest are going to be out there. That's not very many people. They're going to come flying in. The window is not going to open. I'm being told beginning of June. That's what I'm hearing.
I think sometime in June.
I'm faced with the dilemma of, first of all, controlling lines. Not everybody wants to have an appointment. And I have people that are going to want to do multiple things. Do I send them from one line to the next line to get back in line, or do I queue them in? Or these are my dilemmas that I've been staying awake at night thinking about. So I'm looking for some direction. You know, that I'm hearing from the state that you can open up if you want to, but you don't have to. The face-to-face can happen. So maybe we could do a soft opening and do a few appointments and get a few people out. I don't know. I don't have a definite how we need to run it. I'm looking for direction.
Madam Chair.
Commissioner Potter?
Yeah, thank you, Madam Chair. Becky, title transfers take up the most time.
Out-of-state title transfers
Well,
take up
try-
the
you'll
most.
absolutely take them. And my thought is if you make a hybrid thing, we're only doing title transfers on Tuesday and Thursdays or something to keep that line moving as fast as you can with the people that have to renew the license and do the more basic things and come up with some hybrid that we're only doing these on these days to help. And that'll give word to the people just doing regular renewals that Tuesday and Thursday, I don't want to come around here because I'm going to deal with title issues. I don't know what the perfect solution is to this, but we need to do something because there's a lot of people backed up, and if they find out we're open, like I said, all other counties, my aunt and uncle from Carver County included, before this all started, they came up here because down there they'd already cut it off. You know, and that line was very long.
Yep. Commissioner Burrell?
Becky, I guess I would just like to run a scenario by, because let's just say one or two of your staff ended up getting infected with the coronavirus. They're off work now, and we have the counters open. So if we did this by appointment only, you could say we're no longer taking appointments right now or whatever if you had to decide to downsize. That's why I think it should all be appointment only. And yes, it's not going to be as efficient, and we can always open it up more later. I think start off with the appointment only. I know it's not the most efficient.
I agree. I don't know where we have the choice. I see no other way of controlling the amount. Not only that, but as Commissioner Potter pointed out, once we open, you're going to open the floodgates and you're going to get everybody for every other county.
So,
Right now, my concerns are Wright County residents. And as far as I'm concerned, you come from Sherburne County, you want a driver's license. No.
I don't know that we can
want to deal
restrict
with
that.
Wright
We can't
County
restrict
residents.
that.
Pardon?
we can't restrict that.
No.
Oh, I don't know. Why can't you?
No, I think we probably would lose our
we're-
right to have a DMV if we
Because
said
they're
that.
deputy registers for the state. so-
Well, that's a question to ask.
It was asked, excuse me, Madam Chair.
Nope.
But it was asked at the last webinar I was at, and there were people that said, I will schedule appointments for my constituents only. And the attorney for DPS got on there and said, you can't do that. Not allowed. We will not say you cannot do it, we will not promote it, but you are a state deputy register. You have to do anywhere.
But
I mean, nothing we're gonna do is ideal for now, because it's just the way it is. But I think that, we have to take, if you wanna say the most efficient way of doing this, I mean, I know some people would rather just stand in line because they just they're here, they're gonna wait, it takes an hour, it takes an hour and a half, they're gonna do it because they need to have it done. But if we do have appointments, then hopefully that would help mitigate some, and you can take, I don't know how you do that, 3 every 10 minutes, or how do you do that? I don't.
So can we do it like,
Like the
can we do it like an online queuing system? Where I mean, because we don't want to do it via phone appointment. There's just no way. It has to be done like a restaurant style where, you know what, I can go in, click on my app, I'm in the parking lot, it's going to buzz me, I can walk in when my ticket's pulled in, do it a lot of. Yep, where I go into a restaurant, I put my name, I go log in, I'm going to want to eat a table at 6 o'clock, they're going to tell me it might be 6:30, I can sit in my car and wait, they can tick me down how long it's got till my table's ready.
Matthew's got the answer. He's our technology whiz. He knows exactly how we can do
Here's
it.
the deal. There's currently a meeting going on in the IT department that I'm missing that is discussing scheduling some stuff for certain people that might be in this room. We have 2 options available. One of them is free, but we haven't really tested it out yet, so it's a slight unknown. The other one is cheap, like 15 to 25 bucks a month, but it's being used by other people in this room that it works very well. But here's the deal. We've got to stay within the limitations of what the technology has. So if I can schedule in 5-minute blocks, 10-minute blocks, I'm probably not going to be able to get the little discs that go out and sit in your parking lot. There are other programs that are out there that are being used. However, we don't have them. We're not using them. I think the best option is to allow us to huddle for, just let me know who needs to schedule stuff. Get everybody in one room, virtual or otherwise, we could get in here and just make a big round table. Pick one solution that's gonna fit everybody to 70% and work within the realm of the technology, because any scope creep is gonna knock us right out of the park. But if it's as simple as something, for example, I know one of the programs that's being used, it works well, you can ask certain people about it,
Don?
but it doesn't integrate with Outlook, it's not sexy, it doesn't do all the, great functions, but it schedules time for people to show up.
Okay.
So what I think would be the best option is to sit with us, find out what's gonna work. We can do it on Monday. Come up with a plan, present you guys a plan and go forward with that. But like I said, we have one option that we have already that's free, and I like the word free.
Yep.
The other option is cheap, relatively, 15, 25 bucks a month is not bad.
No.
But we need to pick between the two, and we need to pick quickly.
Why do we have to pick between the two? I mean, there's better ones out there. I think long term. I mean, you use like an.
I'm thinking Band-Aid only. This is to
Yeah.
get us
Band-Aid for
through
now.
a few weeks to a few months.
months.
Honest to God, we need an enterprise scheduling system.
Oh, yeah, but I
that's
mean-
a longer-term issue.
But like this stuff here, I mean, there's things that you could even inexpensively, okay, let's use the platform that Open Table uses. Super easy. I go online on my app, I pick a time, and I can actually define those times in increments of 1 minute if I wanted to. And then at that point, literally, if it's 5 minutes later, whatever time, me as the DMV can go, oh, now I'm ready. Boom, I ping them and it vibrates their phone. Nope, now I can come in.
There actually is a program out that was made by a company in Minnesota. We just have not contracted with them that. It's being bounced around. I hesitate to mention it because I know very little about it, only that other IT directors are talking about it. But I don't want to, we have something we know works. I don't want to jump on something new. If we got to open in 2 weeks, I don't have time to really investigate.
No.
No.
So what I would prefer to do, get everybody in one room, sit down, come up with a 70% solution that's gonna fit everybody. Everybody accept the fact that 30% of what they want is not gonna be able to be fulfilled, and then we jump on it and Band-Aid this. This is not a long-term, this is just get us through a few weeks. But Sean uses Acuity, that's one of them. It seems to work okay. I'm not putting you on the spot, but
Right, if the
I
board
am.
says appointments only, we can figure it out.
And we have another program that we can work, we own in-house that's free, but we haven't rolled it out yet, so I was gonna try and do a demo of both with somebody else and let them pick, because honestly, I just wanna support the customer.
Can either of them be done online?
Well, Acuity's totally online, so
Okay.
it's all web-based. Now, here's the kicker though, if you're in the county and you don't have access to a computer or anything, you can't schedule anything, and that's gonna disenfranchise a certain population. On the flip side, it's also not sexy, it doesn't integrate with Outlook, so you have to go online to check, things like this. I think that we can go round and round on this. You tell me who to sit down with, I'll sit down with people, we'll get it done on Monday, I'll find out if this will work. We'll look at one of two solutions, we pick it, run with it for everybody, get it rolled out. At most, it'll cost us maybe $150 a month or free, somewhere in that realm, but at least it'll solve a problem for maybe 2 or 3 months until we can get something more long-term.
Well, and plus, I mean, we don't know what 2 or 3 months is gonna look like anyway, but I think that to roll something out quickly.
Well, I mean, we do
you
have
know.
the murder hornets out there, so who knows what's gonna happen.
That's
after
true.
that.
So we're fine being the 30%. If you tell us we need to do appointments, our people are used to contacting us usually first, compost, building inspections. We will deal with our appointments internally and do it right and efficient. If DMV has such a large quantity, because they do, and they need a proper and formal system, I would recommend not dragging them down by what we can already handle. The difficult part is getting the public to buy in and do it. So the system isn't going to influence that. We'll have to do that at the staff
And
level.
just to understand, I'm suggesting the platform that Sean's using could be used independently. Every department would be responsible for their own platform.
Right.
I'm gonna say, which I think you guys, I'm reading into that you would be on the same page as me, that walk-up window outside is not gonna be by appointment. Because when that's put in.
Oh, I agree.
I mean, okay, I
That's
just wanna
fine.
make sure, because if we're having that, if we're going to the work of putting in that outside window, I want that not to be.
No,
an
that's fine,
appointment
but you
piece,
can't
so.
do a driver's license on that one.
Yeah,
No,
but
but no,
that'll
but
take care of that one.
that makes the quick piece for those people that want to just come and get
Yep.
their tabs done real quick. Boom.
There's a lot of people, I mean, I think the Dropbox for the tabs has been working wonderfully, hasn't it, Becky?
Yes, very well.
So if people have gotten used to doing that, I think, that's already part of the solution, so.
I agree, Madam Chair. That we are also, and I don't know if this piece of the puzzle has been brought forth to you, but there will be a drop box. That's going to be a drive-up drop box in the alley right outside our office. That's going to also alleviate a little bit of people standing and walking up.
Right.
And our curbside that has been, worked great last week, we're doing again today, we'll see, get
good.
some more, and then see how it works, that we're offering that they can come back and pick them up, you know, at a certain timetable. That's helping with the motor vehicle transactions. Every one we do right now is not going to be in line when we open up. That's my way of looking at it, that we're getting that much done, okay?
Right.
But there will be that drive-up drop box also. Maybe I'm an old farm girl, but I know I cannot do only appointments. I know
Yeah.
that.
It's gonna be modified, yeah.
I know I can't do only that. I
No,
know that we're
but,
gonna
but
have,
you, but you won't have to. You're gonna have people that are just gonna show
they
up.
are gonna show up, and then I'm gonna be looking for some kind of control. How am I gonna control those people, and where am I gonna put them? I don't know.
But that we have figured
That
out.
we have to figure out.
So do
We
you,
have it figured out.
So do you say 2 windows are by appointment and then the 1 window is for walk-ups? Well, so the walk-up line is gonna be,
Yeah.
and then just what the 2 that are by appointment, if people don't show, they can just backfill people through
I'm overwhelmed.
Yeah.
yeah.
With that whole thought.
And this might.
Then it's
this
hard to
might-
time it out because one thing can take 5 minutes and one thing can take 30 minutes. Just really depends on, how do you schedule appointment blocks? Do you just arbitrarily pick 5 minutes for everything and some things take a lot more, some things take less?
Well, if I'm doing a real ID or an enhanced driver's license, takes a lot longer than doing a standard because there's documents and
Right.
copies and things like that. So, but it also happens that people get to the counter and say, I don't know what I want. So what do I need for this and what I need for that? And I have this, so I'll do this one. And I don't have this, so I can't do that one.
Yeah.
So,
Or I get to the DMV and I saw like somebody like Mark gets in front of me that has like 15 titles or 15 tabs to get and doesn't have their insurance policy written on any of the slips and you're going, no.
Well, I think
And then
that,
you gotta quit being so damn nice and you tell people. And other places do it. Here.
I do it.
Here's what we need to do. Go over there at that table, fill out the stuff, come back.
Get back in line.
well, and I think that,
Or no,
what we're
you
gonna,
just
when
take
we
them there.
open, we're gonna, figure out the best solution to open on, say, May 27th or the following week, and then we'll find out if that works, and if you need to tweak it, we'll just have to get as much information out to the public then as we can. This isn't working, or this is working best, and,
But that's why we need to figure out now so that we can start getting that information out there.
Right.
Because you can't do it in one day.
that's what I'm saying. We'll figure this out,
Now,
but then if it doesn't, going forward, if you need to tweak it, it needs to
See, but the hardest thing is a lot of people go to the DMV, i.e. my wife. She didn't realize she needed to get her license or didn't know she needed a marriage certificate. So she went upstairs to get her marriage certificate. Now, we can't, because theirs is going to be a lot of driven by what happens at courts or what happens in her office, they're going to go to the recorder's office. Now, I really don't feel like the recorder's office can be by appointment because 90% of people that are going to the recorder's office is because they didn't know they needed a piece of information that they were requested from either their office or courts.
look,
So-
let me ask a couple questions first. I don't, and Tanya, we'll find out here in a second, but think about how many do you actually have during a day, a normal day? Not under these circumstances. But Becky, of just those few phone calls you get every day, what was it, 230 or so, about average, 250?
we're between 230 and 300 phone calls a day right
Okay.
now.
So just on those few that you've been getting, what are the questions that is the only question, are you open?
That's the first one. Oh, you are open. That's the first statement. And the next one might be, oh, nobody else is picking up their phones. Thank goodness you can give me the. That's a big one. And then I need to renew my driver's license. When can I come in?
So no.
And it used to be, I want to explain those 3 different licenses to me. That's not really in the mix right now. I get that once in a while, but mostly it is just that I need my tabs, I need my driver's license, I need to do this. So like I said, the Dropbox is fulfilling a lot of that, the tabs especially. But the driver's license, is going to be our biggest challenge of how we are going to get people in safely, have them safely, and then leave, get out of the building.
Again, I still see no reason why you can't do appointments for driver's license only, because you're gonna have those people that their license doesn't expire till July, and they're gonna all be coming in, and then those people are gonna run out of their 60-day safe zone. And that's not fair to them, and you're gonna have to, I don't care what Department of Public Safety says, we're in a different world. You're gonna have to do things that are not normal. And that's where I think you're gonna have to go with appointments and say, if your license have expired, you're first.
Mark, what have we been doing the last 2 months that has been normal?
And I know, but they're saying that, no, you have to accept anybody from anywhere in the state to do a driver's license. We're gonna have to be a little bit
Well,
selfish for Wright County residents, because that's who pay us.
Commissioner Burrell?
And Becky, as long as you're at the podium there, I did ask, and I think we kind of asked too many questions at one time, but what would happen if you had one or two people in your office that did come down with the virus? What would happen then?
We'd be closed.
That's the end.
I don't think I have a choice.
I didn't really understand.
They'd be closed, she said.
We are in close proximity.
Yeah, so they'd have to be closed because that means that they would all have to go into isolation
Potentially, yes.
for CDC
So then
standards.
I think it would behoove us all then to take baby steps on this and just do a little bit at a time and do appointment only.
And that's what, I think, if the huddle group gets together on Monday and figures out, how to do appointments and that kind of thing, but, yeah. Tanya, you had something to offer us?
Words of
Morning,
wisdom.
Madam Chair and Commissioners. I was just going to say that we need to work together as far as whatever she decides. It affects us for birth certificates, marriage certificates, anything to do with the real ID. They're coming up here, then they want to go back down and get in line again. As far as appointments go, we are doing appointments. We have been since April. We're just using SharePoint, scheduling everything in SharePoint, but we're doing a lot of phone work. So if they were to do appointments with the real ID, that's their opportunity to spend that time on the phone, educate them. Do you have this? Do you have this? So that they can get that ahead of their appointment. So
Right.
those are things that we could talk about. And using SharePoint allows us to control the appointments, control staffing. Right now, we're doing appointments from 8 to 1, and then on Tuesdays and Thursdays, we're doing them from 8 to 4:30 to allow for those afternoon appointments. So I just wanted to make a comment that we are using SharePoint.
Yeah.
We did offer, if we have that booth out in the hallway right now, if the auditor's office wanted to use it for appointments, we could share our calendar with them and they could plug in appointments. We are dealing with people that cancel, people that call, I'm running late, I'm not going to be there for 15 minutes, and so we deal with that. And then the next appointment we already have, so now we have the issue of one showing up early, the other one showing up late, and they're there at the same time.
Look, you got an appointment, you show up on time, you're there, you get it, you don't have your stuff, you go home. You're late, you go home. Something else happens, you go home. I mean, at some point, we just have to be honest. You gotta be a functional adult in today's society, and if you can't be 5 minutes early to your appointment, you never should have scheduled it in the first place.
But this is America.
I know.
But
And that's how America works.
I-
1.4 military people, 1.4 million military people.
And
If you show up on time, you're good. You're
So-
5 minutes late to your appointment,
Never should have shown up at all.
make another appointment.
What happens if I showed up at 5 minutes ahead of my appointment? I thought then you were late.
Well,
If you're ahead.
depending on how your chief looks at
Okay.
it.
I thought that's the way the Army, I thought that was the way the Army was.
If we implemented a schedule, you show up with all your documentation. You don't have it, reschedule an appointment. You know,
Yeah.
that's the only way we can do this.
And that's a good point you bring up, that when they call to make appointments, because some can't do it online, but it's like, okay, if you need these documents for this transaction, and I think that, people just need to know that, and however we need to get it out, however many ways we need to get that out, with signage, with our phone calls, with online, with newspaper articles, whatever. I mean, I think that working with John Holler to communicate some of that's going to help too.
Madam Chair,
Commissioner Potter?
thank you. There's no way you're going to be able to open up these windows before early June. Because by the time you do the huddle, they get a game plan, you get the word out how we're going to open this so people understand, you're already in the first part of June. It's just not going to happen at the end of May. It's not happening. And second off, with the walk-up thing at DMV, that'd be nice to have that done. And then have a plan. This is how we plan on opening. It'll be preferred by appointment. Talk to people if you have questions on this, and get these things done so when you get there to make this efficiency work so everybody can get what they want done and nobody has to wait. I mean, it's going to be early June. It's just not going to happen before then.
So like Commissioner Vetch had suggested, open up these other public windows on May 27th and DMV on June 3rd, perhaps.
Or June 3rd or 4th, and that's kind of, I was thinking 3rd, but I might say the 4th, because we know that Windows stuff's gonna be close in there, and I hate for them to be doing the construction on that,
That
well,
one has gotta be done.
Yep.
I agree, before we open.
because I was kind of saying that, you open everything except for either DMV, and then I didn't know what we wanted, if you wanted to hold out another week on the Auditor Treasurer's office, or, and some of those ones, and do the,
I think just open up the public
everything on the
windows
27th,
May 27th, and then DMV on,
June 4th,
June 4th.
targeted for June 4th on the DMV.
and Chief Deputy Trickler, did you have a comment?
Only let him talk if he's gonna make our life easier. If he's gonna make it more difficult, don't let him talk.
Good morning, Madam Chair. Good morning.
Morning.
I can't guarantee making anything easier. I can just say that we've been doing appointment only at the Sheriff's Office for over a month for jail visiting, records, gun permits, civil. It's been working great. We haven't really run into any issues. We have somebody by our front door who checks people in, they have a booth, they're behind plexiglass. If you don't have an appointment, they'll call up to the front desk. Do you have time to see this person? They say yes. Great, go up. If they don't, nope, you gotta go back online, either through email, through phone calls. There's 2 numbers to call, one for records, one for everything else. And we do it in SharePoint, make appointments. We haven't had any issues. I don't know how the DMV works, so I'm not gonna speak to that, but it seems like certain things could continue online or through the mail. Other things, your license renewals, your vehicle titles are appointment only. And you have a counter right up front here that could be your check-in point for your DMV. If you have an appointment, great, going through. You don't, here's how you make one.
Difference between you and DMV is you all have guns, they don't. People are going to listen to you when you have guns and say,
You
this
make
is
an
the rules.
appointment,
Any
you can make an
questions?
appointment to get a permit to carry.
Guns.
Permit to carries are available.
Right.
No,
and-
but
and
you
there's-
got, you let them know what the rules are. Here it is. If you.
And
don't
one last thing,
do
and
this.
if you're looking to advertise whatever you decide to do between probation and us, we've got a pretty large social media presence. The county, your website, we've got ways to get it out there.
Right, yeah, and I know that with court services too, and, they've been operating very well, and as the sheriffs, and I think everyone has, given the circumstances, but going forward, opening up the public windows, it's, I don't think everyone's gonna just rush in, frankly, except for DMV, because when they need their licenses, but, yeah,
I can tell you, I'll have veterans rush in.
yeah.
So we're looking
That
at
fast?
targeting, so Wednesday, May 27th for all department windows, except for DMV, we're gonna target June 4th.
Yep, and Matthew will work with the huddle group to figure out how to
Who is
set
the
up.
huddle group?
Well, that's what, we'll have to send out an email to all department heads and
facilitate that.
ask.
Can I make, Madam
Sure,
Chair, one
yes.
comment? When you say opening, be very clear in that statement, because if you just say opening, that tells everybody we're open. So when you say that, we're open for appointments.
By
Appointments.
appointment.
Yeah.
Right.
Which we already were open for by appointment. So that's
No,
why
I know,
I'm
but-
Exactly.
You gotta make sure it's
You
in
gotta
the
make sure
narrative.
you reinforce that
It's in
with
the
every
narrative. It's gotta
presence
be
you
in
put
there.
out there. We're open by appointments.
And that's where I kind of wrap my head around this, because we're really not doing it. What are we doing differently other than what we're going to have the gates open? I mean,
Right, but if you say open, that's what they hear.
so
They hear
but
gates are
if your
open.
gates are open, it's going to be really challenging for somebody to say you're all open here, and now I can't talk to anybody. I mean,
I
No,
understand.
that's not the case.
So,
It's gonna help control the flow of people. If you have appointments, you're
you're going to send a message that says have an appointment, but if you don't have an appointment, we'll actually still help you.
well.
But you
if
might
you-
wait longer.
But your people are gonna show up.
Okay,
And,
I
you can
I
tell
encourage
them.
you to say open with by appointment in
Yeah.
the language that you use when you put that out.
But you're gonna have people that come.
Right.
And just like you say, we don't have the time right now, you're gonna have to make an appointment. Here's with somebody else, they'll make the appointment with you.
Well,
If you don't have anything going on, you can say, yeah, we got an opening, let's take care of this now.
Right. So
when we
the
say
oth-
we're opening the public windows were not open before. Now they'll be open, but it'll be by appointment. so.
Right, there you go. That's just the way you say it.
Right.
So
and
the
we're-
other part is,
government facility is open for business by appointment.
The public windows are open by appointment.
But you're not gonna get everybody that reads papers or sees it online. You're still gonna be dealing with people that,
And
there's nothing you can do about it.
You're gonna have a huge I mean, I look at it, when we had to close down the DMV that day, March 18th? And there was probably, 45 people in line at that time. And I can't even imagine once there's a release that says government centers open and by appointment, for whatever reason, you'd have to put it in the biggest, boldest letters by appointment, because I can just
but
see
if
it
you
now.
don't, it's gonna be worse.
Yep.
Oh, yeah.
You know, Becky, do we have any idea when Sherburne and Hennepin are gonna open? Because I think should be part of our timing also. I don't wanna be open if they're not open.
Madam Chair and Commissioners, I heard, my memo today said that there are going to be 16 testing stations opening on Monday. That does not mean that there's going to be service available at all deputy registers. Okay, that's going to be up to them a piece. I would guarantee, I'll bet the farm on this, that come Monday morning at 8 o'clock, there will be a line outside my door. Because we're having people right now that are already hearing it's lifted. That's all they've heard. It's lifted.
Stay at home is lifted,
Yes.
which means everything's gonna open.
But I will guarantee Monday morning, there's going to be people standing outside my door, pounding on my door, waiting to come in because they think we're coming back. We're back. It's back to normal now. And it's going to be a rough couple weeks for people to wait for us to open. And then when we open, it's going to be a rough forever.
A month or
Right.
two after that. Yeah.
And that's why we can't exactly wait for Sherburne and Hennepin. We're just putting this off and putting this off. So we want to do this, smartly.
What if we?
But,
we take the side doors, make them exit only, you gotta come in the front, and somebody is there saying, do you have an appointment? Yes, go. Do you have an appointment? Yes, go. Do you have an appointment? Yes, go. Do you have an appointment? No, get out. I'll do it. I don't need to.
Well, the other question I have as part of this too is, we're focused on the public, but what's our status of mask, disinfectant?
Absolutely.
That.
Mass.
That's another
We're not
question.
requiring
We haven't
masks.
talked about yet because that affects
That's another
Absolutely.
discussion.
all this.
I agree.
Mike, want to come up and,
Yeah, mine's a little different, but actually, Commissioner, Madam Chair, that I actually think he's right. I think that's good customer service. I don't think that's restrictive. I think it's actually going to help you open up in an orderly manner that's going to guide people in the right spots. All kidding aside, I think that's not a bad move. If you go into other places, you're dealing with it all the time. Two things and they revolve around marketing. We have to let people know what's going on. And me and Matt were just talking about, we have 4,000 people in our database. Human Services probably has a lot more than that. The sheriff said he hits 13,000, or Matt said they hit 13,000. We will help you get stuff out, but we need to get it so we can get it out to help with that deluge that some departments are going to face. We're not going to face that. I get it. That's not. I mean, we're going to escalate our opening, as you know. But we have more control over our customers than other people do. But I do think we need to market that. The second thing is, I think we're all willing to help each other. It's one county, one team. The other thing is we also need to make sure we're sending that same type of messaging to our staff. Because some of our staff are hearing, we might be open on Monday, just so you know. I mean, there's a dual messaging I think that needs to take place sooner than later. And John's not here. But I think we're willing to help you with that, because the quicker we can get that real message out about appointments, because she's going to need help with appointments. I don't think it's bad to say we're doing appointments, but they need to know that to calm things down a little bit when Monday comes around, because people probably are expecting that a little bit. But I do like the whole idea of shutting the doors down, having somebody help man that, and I think that would save you a lot of phone calls, but my 2 cents. But marketing is going to be important. I think everybody's going to be individually in a different spot. That's just a reality. It's where we've been. Every department's different, but we all certainly can support each other.
Madam Chair, I agree with that. We need to have the message out there. The public knows exactly what we're doing. It's not just the gates are open here, come on in.
Right.
And they need to know, because we can't let somebody, well, I heard from the governor's team that we're open. I heard from so-and-so over here. We need to let all the outlets we have what's going on, and like I say, with the staff too, so they know what's going on, so it's not just big overwhelming rush on it. And have somebody, at least for the first couple weeks, to guide at the door. I don't think that's a bad issue, because then people will get programmed into, okay, this is the way it is right now. And maybe in a couple months it transitions into something else, I don't know. But we gotta get that message, has gotta get out real clear what is and what isn't gonna happen. Because if we don't make a nice clear statement out there, the people are gonna come here and then they're gonna be PO'd like you wouldn't believe, and they're gonna look at all 5 of us, only 4 because they can't see Charlie, and they're gonna be mad. They're gonna say, you've had all this time to make a game plan, how come you didn't make a game plan?
And that brings to the point that Greg brought up, is that it's not just our external customers, it's our internal customers too, our employees.
Yeah.
What is the rules? And as Jamie had said, she's got some employees that said they won't come in unless everybody's wearing a mask, and some employees that said, I'm not coming in if we have to wear a mask. So what do
They gotta be available.
well, that's the thing, is what, we're gonna have to say what we're gonna do.
Well, and I think that, we have our board meeting on Tuesday, and we've come up with some opening plans.
We have, yes.
And finding out what the group comes up with setting up their appointments, or what's a good platform for doing that. Some of you already are, and it's working well. So as far as personal protective equipment, we do have masks.
We do, yes. I guess that's the point, and I would make the recommendation at this point. We have made voluntary usage of masks, or face coverings, I should say. I want to be careful in the terminology and being specific, not PPE, but I think the strategy is that we should promote, but make voluntary for staff to wear face coverings. We have some on order, not a great number, but we're working on getting more of them, and I think it'd just be good to provide them to staff that are interested and want to use them. And I think a key piece of it is to be respectful of your coworkers and their space.
Exactly. And I think that's what this all comes back down to is, to be respectful, and people are in different places with this, and we need to not dismiss anyone with any either concerns or, physical limitations on being able to come back, so. But,
So we need to make some definitives here, because we've had discussions about closing side doors, main entrance. We've talked about appointments, so we need a definitive answer here as a board. Yes, we're going appointments, or no, we're not going appointments only. Are we gonna allow just entrance from the front, or are we not, are we gonna allow it the way it is currently? Is it 100% then definitively May 27th for all offices to have their public windows open, except for DMV, we're gonna target June 4th? I just wanna make sure all this stuff at some point has to get wrapped up into some sort of a motion.
Correct.
My recommendation is, let me know who I need to meet with. Monday, there's already a demo scheduled for one of the appointment programs we can use. I'm setting up the second one. I will meet with the applicable people, go through the demos. It will be democracy rules. Whoever, we'll pick one, we will go with it, and then department heads can present you a plan on Tuesday that will say, this is what we need to do.
So, because look at all the public windows. You have VSO, assessors, recorders, HHS, extensions, PNZ, DMV, auditor, treasurer, and admin. Those are all the ones that have public-facing windows to it. We're already open. You're already open. Same with the attorney's office and the sheriff's office. They're already open, so it doesn't
I
really.
spoke to Matthew when he left. He said, we're working, we don't need you. I said, that's perfectly fine, go do your own thing. If it's broke, don't fix
Yep.
it. I'm only talking to people who haven't opened yet. But if you let us just have a quick huddle, just tell me who to huddle with, and I will sit down with them. I got the demo scheduled for Monday. We will pick a product, and hopefully we'll have it done by Friday. And then we will let you guys know, this is our recommendation, close the doors, station the person,
Because PNZ's already using something, so really
so is recorder, and
We're good at making appointments. The issue is, are we being directed to do it or not? 10 days to pick a system, learn a system, incorporate a system.
No, use what you got. It
I know,
works.
But then
Use
if
it.
it's going to lead to only the door is open, now there's a person here, they have to be tied into some.
No.
No, they don't have.
No, it's just somebody there that says, do you have an appointment to where you're going? Yes, I do. Then they walk up.
Sounds good.
We'd have to trust the honor system. If they lie, what can we do?
There's not much.
I have recommendations, but
But
they're
then
not legal.
does Becky service them when they get to her window and they didn't have an appointment?
No.
No.
No, we stick to our guns. You don't have an appointment, you show up,
Maybe
you lie
I-
about it. I'm sorry, thank you very much. Now we're gonna hang your picture next to the door saying, don't serve that.
So here's the one off. So if you went to the DMV and you didn't realize you needed a
wall
marriage
of shame.
certificate and you had an appointment at the DMV, they said, nope, you got to go up to the recorder's office. Now, nope.
Nope, don't have your stuff, schedule the recorder, go see the recorder.
Oh
then go
my
back to
gosh,
DMV.
this is going to get messy.
But you've gotta be. Why not?
Well,
Why not if they're willing to wait?
Yeah.
I didn't say that it should all be by appointment. I just said, if you have a plan.
the problem is,
Exactly. That's why I want to make sure that we're
in the
flexible.
hallways,
But if that person is
you've got them
coming and
close
already
next
has
to
an
each other.
appointment,
This is gonna
built
have,
into this
we're gonna have to, and I apologize for putting it this way, we're gonna have to expect people to act like adults. You show up, you don't got the right paperwork, you come back. You need something in the recorder's office, you gotta go home, schedule the recorder, then reschedule an appointment. This is, we can't have people just lingering in the hallways.
I wish everybody was
I know.
treaded as water as well as you do, Matthew, but unfortunately, I think the general public maybe isn't quite there yet. Because there's a lot of these things that they're going to renew a license once every 5 years, and this is a totally new animal to them, so they're asking for new documentation, and no matter how hard we try to educate them, would you say, Becky, 50% of the people come there without the right documentation, wouldn't you say?
Absolutely.
Yep. I mean, that's just, and I don't know that we could ever get it down to.
But then again, if you're making appointments, it gives you an opportunity to say, this is what you're gonna have to bring with.
But are we doing it via phone?
No, we're gonna have to
That's
do
what
it
I'm saying,
online.
and that's what I'm saying, because
not everyone will be able to do
they
it.
never read everything.
There are people that are gonna call in because they're not tech
Right.
savvy
I
to
mean,
be able to.
we've got a lot of people that don't, have good internet service that are,
Well, we could leave that option open, but if there's
You're gonna
nothing
have
on
to.
there.
You'll have to.
Do they have the bandwidth for the employees to do a phone appointment system? I'm just curious, Becky. I just putting it out there.
I'm sorry, what was the,
Do you have the staffing to be able to facilitate phone appointments?
well, not with 300 phone calls coming in. I have a staff of 9, including me. 3 at the counter, in the back room, that's 5. I gotta have at least one person working on dealer work and another person working on phones and Dropbox. That's, okay. I gotta have somebody out in the hallway rolling in this way. If I have somebody calling sick, I gotta pull from one of those places, okay? And then I haven't even discussed the cleaning part with you guys. How are we gonna do that? Do I need a person, spray bottle? I don't know.
Yeah.
I don't know that I have enough staff. And I'm kind of with Matt that they're gonna, in a perfect world, everybody's gonna need an appointment.
That's why. You're not gonna, you don't have a choice.
But-
You have to.
But what about the people who don't have the internet? Don't listen.
Right.
And that's why you're gonna have to do it, and that's,
But they can show up without their stuff and say, look, you don't have your stuff. Here's an appointment next Wednesday. I'll put you in on it. Come back next Wednesday at this time.
We're still taking time out of the day. I mean,
there's just no way you're gonna be able to do it come hilly-nilly. It's gonna have to be by appointment. There's just too many people with too many different scenarios, and without being able to control it, there is just no way it can be done
Which is fine.
safely.
Which is fine, but then it's the matter, does she have the staffing in place to be able to facilitate that? 'Cause
Well,
if you're-
we're gonna have to figure out a way to
That's what
do
we
it.
have.
That's what I'm saying, because you have 2 people working this walk-up window, you have 3 people working the appointment windows, you have 2 people doing dealers, and now we haven't accounted for anybody sick, and now we haven't accounted for anybody to facilitate the phone. Okay? That's where I'm.
Well, but we've got other employees that are not working full-time right now at other locations, that there's no reason why some of those from other departments cannot be helping out right now.
Isn't there a requirement, is there licensing or things or requirements?
Well, yeah, but to answer a phone, no.
No, okay.
To do crowd control, no.
To make an appointment?
No.
No,
So
okay.
there's no, we do not need people trained to do driver's license.
Oh, Mark, looks like we get to each take shifts and make
That's
appointments. for the
fine.
DMV.
I'm more than happy to do that.
Okay, Bob.
Life is not gonna be the same.
You're right. I'm just trying to point out the.
Too many side conversations here. Okay,
That
Bob?
works.
Madam Chair, Commissioners, I think one of the things we're going to have to address is a lot of our customers have multiple departments that they want to see at the same time. Our customers will want to go to the recorder's office and then over to us and likely to go back. So when we meet with Matthew, we're going to have to talk about how would they make appointments with multiple departments at the same time.
Yep.
we could work that. They schedule a 10:15 with you, a 10:45 over the DMV, and an 11:15 here, and then a 11:45. I mean, that's possible.
Yeah.
It's possible. It's like trying to get all my kids' conferences done in 3 hours, but the odds are,
And we,
in a perfect world, it's nice to happen, but Brian, with us with lots of kids.
Mike
Yeah.
just brought up a very valid point. If we need somebody to sit on the phone, we take somebody that is not being utilized full-time elsewhere. I can have a phone number forwarded to them, and they do nothing but sit at their computer and schedule things. I mean, we can work, they could do it at home.
Yep.
I mean, there are ways we can do these things.
You gotta think outside
We just
the
gotta
box.
think, yeah, we gotta think a little bit outside of the box, and we just gotta hold to the process. We can't deviate. And if the process, if it's people are gonna come in, we're just gonna have to tell them, we have to send them away. The only option we could either do is by phone, and we'll have a phone bank, it'll look like a PBS special. We'll have people behind there doing nothing but answering phones. But, and when we do that though, they're gonna have to call in, they get the scheduled appointment, and if they show up, the same thing happened to me. I showed up, didn't know I needed a marriage license. I didn't even have a marriage license. I had to go to Baltimore to get my marriage license, which, by the way, says that my wife is from South Carolina. It's not even a state. She's from South Carolina, but they wouldn't fix it. So, nevertheless, I mean, I didn't have my paperwork, I left, and I came back. I mean, that's, what happens.
What a good sailor.
I know, right?
Mike, you had a comment?
I don't want to be on the record to say that I thought everybody should do appointments, but I like that. But whatever you do, you have to make sure, even if they do come for, if they, people are gonna walk in. That's just human nature. I mean, I'm that guy. I mean, I go to the federal building to get my passport because I think it's a cool thing. I still go to the lobby of the bank. We still have those people. You just need to be able to direct them someplace. And if that's an appointment later, you need to be prepared for that because it's gonna happen. And, but I do think we have the resources to have different ways of doing business. It's out there. I mean, the big box stores are doing it. The Best Buys are doing it. They're all doing it. It's just cheat and steal from them. That's all.
Right, and we have, 12 days to implement this and get the word out.
Absolutely. It's not
And,
going to happen tomorrow.
and in the case of DMV, 19 days, so, yeah.
Madam Chair,
Yes. Who's,
this is Tammy Veit. Sorry,
Oh,
Madam Chair,
hi, Tammy.
members of the board. Hi. Just listening to the discussion, obviously, I feel that there's still a lot of planning that needs to be done. I mean, you're hearing a lot of different department heads, providing some input and feedback and whatnot. My concern is I would hate to see that we've got a tentative opening date, and then all of a sudden we have to go back on that. I am concerned that other counties are not opening quite yet. I'm aware that Hennepin County is looking to basically keep the majority of their staff at home throughout basically the rest of the year. I don't know what that means for some of their departments that are more public-facing responsibilities like DMV, passports, and whatnot. I feel like there maybe needs to be another meeting, like a planning meeting, moving forward before making a decision on dates.
Madam Chair, and
I'm hearing everything being discussed.
Tammy, that is a good point, Madam Chair. I think maybe what we do before definitively setting a date, we have a committee of the whole, give time staff to kind of, or IT to kind of look at bringing a recommendation on an appointment setting piece, come back, hash it out, and then formalize it, because I think we're making recommendations on not knowing whether we can facilitate it or how we're going to facilitate it.
Then fine, that's okay by me, but that I want department heads coming here saying, this is how it will work for us. Not, well, it's not gonna, we can't make it work, we can't do this. Damn it, we're the government. Do we want to be people saying, we don't know what the hell we're doing, which is what they think now? We need to come up with the plan, and it needs to be firm, and it's not a one-size-fit-all, but department heads need to come in with answers and not saying, well, we can't make it work.
well, and I think that we got that message already out there in saying that departments need to work with their staff, and if there's people that can't come back to the office, that's up to them. So I think that we've already made that clear. When we open, I think that gives us actually almost 2 weeks to prepare for opening our public counters. So, and I believe that departments can figure out ways to do this safely, and people think it's going to open on the 18th, and we're not ready to open on the 18th, but I believe that we could open the rest of them. Some of them already have been open the whole time, so that we can do it
They've all been
in the 12th.
They've all been open the whole time, the
Public
service
counter,
one way or
the
the
public
other.
windows, so. Yes,
Mr.
Sean.
Chair, Commissioner Delight, yeah, this is a tough moving target. We haven't been preparing for a phone bank where Target, the doors are going to be locked. It's only 10 days. It all sounds good, but until you know what the system is, just say, unless DMV can figure it out and other people want to sign on, planning and zoning, assessors, auditors, recorder, whoever wants to be part of that, continue to schedule appointments and service your clients as you're currently doing it. And if they're going to come in, make every effort you can to have it be by appointment so we can control the amount of people in the courthouse. I'm pretty confident in saying in 10 days, some employee sitting in their house, not dealing with our department, working with some system, isn't going to know the best and most efficient way to schedule appointments for our department.
I guess the question is, Sean, or go ahead.
Oh, I was gonna say that you're looking at kind of the hybrid that maybe we don't need to lock the east and west door. Maybe we've got the signage that, do you have an appointment, you know?
Well, no, that's your decision. If you want to control the building, I'm not part of that. I'm saying at our counter, let our department control how our appointments are taken and limiting people coming to our counter. If you want to say they can only come through that door and lock the other doors or have somebody ask, do you have an appointment? That's fine.
So what you're saying is, are we handcuffing departments to have to use a universal appointment system or not?
That we don't even know about. That's 10 days away.
Exactly. Because you're saying, let us use what we currently have because our volume's not that high. Let us continue the way we are. And if DMV needs to do something different, let DMV do what they need to do.
If they need a window punched out into the courthouse to the parking lot, let DMV do that. We don't need that.
Right. And that's why, you know, we still need to gather more information. What?
I don't know that we
Gonna
can,
happen.
it would be quicker if we, because right now, 80%, 90% of the county departments can operate under the appointment system that they currently have. The only ones that really can't is probably the auditor treasurer's office and the DMV that don't really have a system in place yet to facilitate an appointment system. Everybody else, record recorders, everybody else, am I correct? Is that about the only two? Because even HHS has an appointment system. So why doesn't it just, Bob's office and Becky meet with IT to figure out what they need and everybody else just use their current appointment systems? Is that what we're agreeing?
Well, why change, well, I don't know why we would make them do something if what they're currently using is working.
And that's what Sean wants
That would
clarity
be
on.
foolish.
I want clarity on, is this what we're doing? We're only allowing appointments. And then we'll do our best. But if a township official shows up at my counter,
You're gonna have to take care of it.
I'm going to deal with it.
Right, and
Right.
that's, right, and that's,
You're gonna use common sense.
that's where I'm at, that, you know, I think that we need to have a hybrid of,
Slow
we,
opening, soft, slow.
appointment
It'll take a
suggested,
while to
but,
get.
I don't know,
Madam
The door
Chair?
issue is.
I want common
that's for
sense
you.
too.
So Madam Chair, is there a way, I mean, how soon is too soon if we said we want to sit as a committee of the whole, like next Tuesday, Wednesday, Thursday, to come back with recommendations from department heads and action plans of what, you know, what
For
this
each
is gonna look
department?
like? I mean, we can't go any later than Thursday next week, because we have to make a decision as to what the opening is.
Well, and
I thought we told the department heads to start planning weeks ago about what it's gonna look like when this place opened. Didn't we?
We did. And
Okay, so then, are you telling me that these people haven't done their jobs?
so here, Sean made a good point to this. They made plans based on make sure they're 6 feet apart, that they're about the cleanliness and the operations of how they're gonna interact with the people. They did not expect us to be
But
telling them that they're only gonna do appointments only. So that's the aspect that they did not account for. And that's where they're needing to work on.
And we thought the governor was going to say 2 more weeks.
right,
Yeah.
and that's,
And I guess what we need from you guys, you're okay with us doing appointments only.
yes,
So if I want to do that and no walk-ins, you're good with it. Regardless of, yes, the courthouse is open, it's been open. Everybody's doing some level of customer service as we are today. If I want to continue that level of customer service, we're good.
I'm fine with it.
so as far as a committee of the whole, do you think that we need one, so each department, we can sit down and each department tells us
Chair.
what they're gonna do?
We could
Commissioner Potter?
cross that bridge on Tuesday when we get more information, say, do we need a continuations of that board meeting or not?
But we need this, I mean, I think if we're gonna get to the minutia of it, I don't wanna do it on our Tuesday board meeting and going through every aspect of how this
No,
DMV is gonna look like.
saying,
But you're
if
gonna
they don't
schedule a
have a
3-day
plan, you
posting,
just
then you can't
continue
do it till
the
end of
meeting.
You can
Oh, continue the, oh, you wanna
Continue the meeting without a 3-day posting. You don't have to deal with that. If you could just continue if more information is that we're all here, we could continue this meeting another time and date certain, you're just fine.
So
and
we're-
anybody
I can do
that's
that.
got a plan, and I don't know I don't know what we've got on the docket for Tuesday, but there's no reason why a couple of department heads that have their shit together, why they can't have that discussion with us on Tuesday.
So we're asking department heads to come to the board meeting and tell us their plans?
Well, a couple of them, we're not gonna have everybody ready. But there are some that are
Well,
currently ready.
I don't know if they need to come to the board meeting
Well,
to
then
do that.
submit the
If-
plan.
Submit their
That's fine.
plans.
We just
Right.
need to know.
Submit their plans
So-
by Tuesday.
I'm making a command decision. Tomorrow at 10 o'clock, we're going to meet in here. with-
Well, we're meeting on a Saturday.
Monday.
Okay, fine. I'll move it to Monday. If you're going to be, that way about it. 10 o'clock, I'm going to get demos of 2 different options. Whoever needs them. If you don't need it, ain't broke, don't fix it. We're going to meet in this room. We're going to project it on that screen. We're going to go over it. We can all sit in big. You can come in virtual. We'll figure the virtual crap out later. Jen, if you're watching this, schedule a virtual meeting. And she is, and she will. 10 o'clock, we'll sit down here. We'll schedule it. So that way Tuesday, they will know what the scheduling software is, what its capabilities are, what they can do, and they can come in with the plan on how to do it. And if they already have something that works, they're good. So I think we could hold off until Tuesday to find out how it works. We can do committee of the whole and then do final board meeting for Omni-Domni authorization and public discourse on Thursday.
Fair enough.
Need be.
Yeah, if we need to schedule a committee of the whole or continue the board meeting.
Continue
you're
board
saying.
meeting.
I will be in here Monday morning at 10 o'clock. If you need scheduling software, be here.
Okay.
They don't need an appointment?
No, there is no appointment necessary for coming to the scheduling software meeting. Jen, send out the invites.
But bring donuts.
I'm not bringing donuts again. I fell into that hole once.
So, we are not setting a hard date. We're expecting no sooner than May 27th at this point for any windows to be open. I'm just recapping. So then we are going, department heads that haven't, I thank Mr. Mattice for sending a very nice detailed of what his openings and what his plans are. I give him 5 stars for that.
Absolutely.
If you haven't seen that, Lee can give you a copy of it. That gives you an indication of what we need to have for an understanding of the operations of your departments. That should be coming to us by what, Mark? Tuesday?
We need to have a plan. We need to be able on Tuesday tell the public,
So I see a meet Monday?
Should be.
on Tuesday at the public meeting, we're gonna be able to tell people, we are
This is a
opening.
public meeting. This is
Yeah.
our board meeting, so we
But
can tell
on
them today.
Tuesday, we'll still be able to tell people, and we only got 10 people that watch this, so to get it out in all other aspects, that we are officially opening, and again, I'm not saying that we are, but that whatever the date we decide is the official opening, and what departments, and how it's gonna be.
And what you need, if you don't have what you need right now to open on whatever date it may be, let's voice those concerns now so we can figure out what we need to do to fill in those gaps. If it's because your staffing level isn't able to accommodate phone appointments or whatever it may be, let's have those discussions so we can figure out how to fill in those gaps.
I guess, for me, we thought that it was gonna be June 1st. So I don't know why you can't decide today, let's make a decision about our openings. And I think it can be May 27th and June 4th. I mean, if we set that, people have about 2 weeks or, they have 12 days or 19 days that they have that warning. If you wait till next Tuesday, then you're talking about only 8 days. And I don't think that's, I think we need to make a decision.
Who are you concerning about? Our
Public.
employees or the public?
Both.
Well, the employees should be aware and be ready to go anytime.
Right,
Yeah.
exactly. We could
But
call
the-
them in tomorrow.
But the public, that's why we need to get it out. And I think if we get it out on Tuesday next week, compared to today, I don't
It'll be
think
fine.
3 days is
I don't
gonna
know.
make a
I-
It'll be
difference.
fine.
I don't know if that's fair to the public because they think we're gonna open on the 18th.
Well, we know that's not gonna happen.
We know that, but
And we can tell that right
But I
now.
think-
But that information, yeah, we can try and get that out there however we can.
You have John Holler go, at this point, the board is tentatively planning for a opening of these departments on May 27th and a opening of the DMV on June 4th? Or do we, because I think coming out of this meeting, that there's something that the county should be putting out there so that people aren't coming here on
Right.
Monday morning. We have to make some statement out of
Something
this
now.
I
meeting.
mean, I think we need to make a decision
June 4th is a Thursday.
We don't need to make,
I wanted to
we
go.
just gotta say this is where it's
midweek
at.
Or later. Because that way, if it was a hard opening on the DMV, and we have, then it's not the whole week of it, and I need to give them a couple days to get all their ducks in order coming out of the weekend, so everybody doesn't come in Monday or morning at 8 o'clock and go, well, window's open, no time to talk with anybody, get everybody prepared
Right,
for what the system's gonna look like.
right, that's why I think we need to make a decision about these dates.
Well, tentatively is a decision. Bearing any unforeseen circumstances, I agree, there's no reason why we can't be open on
May 27th.
on the 27th for the majority of the departments.
And you just wanna leave DMV wide open, or what?
Well, DMV the earliest would be June 4th.
You put it out there in the memo to make it tentative dates that we're looking for. We'll solidify it on Tuesday.
Okay.
Because then we'll have the information from the rest of them. We'll solidify it on Tuesday, boom, but get the message out there. These are the tentative dates we're looking at. Just because you're hearing the governor said is the thing, doesn't mean the slight switch goes on right now. These are what we're looking at because there's some challenges. You worded in there, there's challenges to opening up, and we're still having input, but these are the targeted dates for different departments to open up, and Tuesday we can make the hard decision and
Okay.
make that get out there.
All right,
Because that gives Matt and whoever shows up Monday, gives them that time to get their game plan together.
yeah,
And if anything goes wrong, we blame court services. Okay, all right,
I
good.
blame the sheriff, he moved out.
so,
But that's why I didn't blame the sheriff, because it wasn't as much.
so
was nobody
essentially,
there to
we're not
enjoy it.
talking about making any kind of a motion here, we're just making a recommendation, sending this on Tuesday.
Yeah. and
Well, I think, okay, I still want, the idea is everybody pretty much consensus that we are going to go with appointments?
Yes,
So
I don't see
think
how you
in that
cannot.
message that goes out, that needs to make a statement that the county will be tentatively opening on May 27th on these departments and potentially June 4th for DMV by appointments
That-
only.
But to say by appointments, there's a reason why.
Yes,
Based on Department of Health and CDC guidelines to prevent
overcrowding.
overcrowding and, there's a reason. It's not that we're arbitrarily just choosing it.
Absolutely, and I think that's a very good point. I just want to make sure that we're all, then why don't we just make the motion right now, or you guys are just afraid that you might have to push the DMV out later? Is that why we're not making a firm decision right now? Because, I think the May 27th for all the other departments, they already have all the things in place.
They do,
The only two that don't have appointments in place is the auditor, treasurer, and the DMV, and that's the reason I put those two offices on June 4th, because they may need more time to figure out some of the things that they haven't been doing thus far, like all the other departments have.
yep, I agree, and I don't know if it should be just by appointment only, because as Sean mentioned, if a township supervisor
Yeah,
comes
but
in, I mean, we're not talking about large
Again, use
crowds.
common sense.
Right.
Right,
People are not gonna show up for their appointment, and somebody shows up without an appointment. Of course, you just fill them in. It's common sense.
right,
It
so it
just-
can't be only,
No, but you state
appointment.
by appointment
By
only.
appointment.
Because people don't read and are online, so people are gonna show up. Because they don't pay attention to what's going on.
Bob?
Madam Chair, Commissioners, so we can best plan our approach. Is the dialogue right now that says we're not going to open up our windows, but we're going to move to appointments only? Or is your goal that we're going to open up the windows for the walk-up people?
Well, the windows will
I
be
don't think the
open, but
governor-
it's by appointment.
I guess my recommendation is you're saying by appointment as that date
Right,
on the 27th.
yep,
I guess the way I would envision it is currently, we've said our facility is open, however, our public counters are closed. And I view it as that's continuing until the 27th. Is that-
But after the
And then on the
27th,
But after the
27th,
27th,
we're opening up our public counters, but it's by appointment, so.
as I understood
There's a
it.
slight difference in what we've been doing, yeah.
So that is, you're saying we're going to open up our windows for appointments?
Yeah.
appointments
Because you know
have priority, and walk-up individuals will be taken at an ad hoc basis. So, we're not,
You're mixing the language again.
Yep, Yep.
Yeah, because I'm not gonna turn away somebody who walks in the door.
That's what you say. That's what you say. But you know
I'll
people,
deal with the walk-ins and stuff at my
Right.
department when they show up.
common
At
sense.
your discretion, at your,
My discretion.
yeah.
Jamie's at the podium, so she has the floor.
Good morning, Commissioners. And I've tried to stay out of the fracas, and I think it's going to be messy no matter what we do.
Yeah, you're right.
You know, I think, again, we all say we're in a different boat, but I mean, 2/3 of our customers we're case managing them. So we have access to them and can call them and make the appointments as needed versus, you know, we do have some walk-ins because we have, you know, new clients and intake. And I'll tell you, it'll happen nine times out of 10, somebody will come and want to drop off their paperwork and say, well, I just have one question. You know, and so to me, it's not going to be efficient for me to say, we're going to make an appointment for you to come back and ask your one question. It's going to be, can you call your worker, or we'll call you back with the information so they can ask their question. I do have concerns, and I've put it in the survey about the scalability of especially our third floor, you know, lobby here with the number of people that can be in there. One mom walks in with 3 kids and they're tearing around. Well, you know, there's no social distancing now whatsoever, you know, except for mom and her kids.
Well, I guess we'll have to do what they do at Menard.
Well, I think it can work. I mean, I think this will work. I think you do need to be very strong about by appointment, you know, to give our staff the leeway to be able to message what we need to message to clients, so we're helping our clients and our staff. I think, you know, I hope I think there's going to be a lot of, and especially I'm not speaking for anyone else in my area, a lot of concerns, and I hope we have strong HR support in talking to clients, our staff, about what that means about coming back to work and some necessary changes that we may have to make in how we're staffing versus having so many people working from home.
Right.
Because I think a lot of people be second guessing department head decisions, and
And that's why
that's going to be difficult to have those conversations without some strong support from HR and from the board.
Tuesday, we will have to publish or get out there what the county's policy is going to be as far as personal protective. This is what it's going to be. And
I
then-
noticed we didn't talk about things like transportation. I didn't see that in the guidelines, so we're driving people around, and then also like home visits. We're talking about appointments and clients, but probably half of our appointments are done at somebody's home. So I think we'll come back with a plan for Health and Human Services.
Yep, good.
So Madam Chair, I just want to are we tasking admin to look at bringing a plan for somebody at the single front door, or are we going to still keep all doors open? I just want to make sure that admin's getting the right information for us.
Well, I think we're going to have rovers around. Again, if there's people that don't have enough work to do, there's no reason why we can't bring them back here and help us here.
I just, because are we tasking admin to figure out where he's going to find those people, who those people are going to be, and where are we going to point these people at?
Station.
Charlie, I was going to ask what your opinion is of locking doors and having rovers.
No, I'm against locking the doors, but I was told that we have all kinds of deputies that are school resource officers that are twiddling their thumbs. So I think maybe we should have a conversation with somebody at the sheriff's office and see if we couldn't maybe have them do something more productive.
I'll make a motion to have Charlie talk to the sheriff about dealing with the SROs with not doing anything.
All right.
Well, what?
Charlie? Go ahead.
I was going to say they're not in school right now, you know, and they're whatever.
Yeah. Yeah, they have been actually quite busy with records and that kind of thing, but purging and moving, so they have kept them busy, but we can certainly ask, and definitely we have bailiffs that are kind of walking the building now and on a regular basis, but.
Madam Chair, and I believe those SROs are under contract because they're funded by the school for the duration of the school year, so they're really not at the discretion for us to reassign until the end of the school year, so.
Right.
Unless the school is willing to release them.
Release them, yeah, but then we'd be losing the funding on it too, and so I just so you're aware of that.
All right, so did you, you're prepared to make a motion about the openings?
I'm prepared on that. I just wanted,
think we
before I
have
did that, I wanted to make sure what we're tasking admin to come back with, because we still, once again, are you clear? Are you supposed to bring a plan for one entrance, two entrances, or we're not going to even don't do any work on finding entrances.
I'm personally not in favor. I agree with Charlie. I don't want to lock the doors, but I mean, this is a people's building. We do need to, be smart about this and to limit the number of people and the proximity that they're at, and to ask them to have appointments. But if they come in and it's.
We will do what we can.
Yeah.
We can, yep. And that's good, and I think that's part of the marketing then, that we let people know that, we are your best bet to getting the expedited service is to have an appointment.
Right, yep.
And with that, Madam Chair, I'll make a motion that we make a opening date of May 27th for the assessors, recorders, HHS, extension, P&Z, VSO, admin, windows, and auditor treasurer of May 27th. And a opening date of I'm going to use the word tentatively, June 4th for the DMV, just because I really want to make sure that the
Their
windows,
windows
the walk-up windows open, so that one could be a little bit modified for opening there.
And then we would also, I'll second that.
Oh, and those are with the intention that we are going to direct people by appointment for these opening windows at this point.
Right, to,
Direct them by appointment.
I'll second that.
oh, actually, Commissioner Delighten already seconded, but it wasn't quite done, but.
Sorry, I want to make sure I got all the pieces in there for the.
Any more discussion? We've had a lot so far.
Is the horse dead yet?
Yes, I know, I think so. All right, no other discussion, roll call vote, Commissioner Potter.
Aye.
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 Charlie?
Aye.
So with us?
All right, thank you. All right, and we'll,
No, you have one more item that was on the agenda.
What did we miss?
Wasn't there May 5th? Did you do that?
May 5th.
The minutes.
Oh, the minutes we take care of on Tuesday, or we're going to do them
They
today?
were on this agenda
Oh,
for
they were on the
today.
agenda.
It's
Oh,
on there. We could move them till Tuesday if you want.
I missed,
you.
you're better than me.
Yeah, I'd say let's table that until Tuesday, because I guess I didn't pay attention to read.
I didn't see it to him either, so.
but thank you for bringing that up, Commissioner Potter.
I was so used to only doing minutes on Tuesdays, so it didn't
Yeah,
kind of
it's-
flew over my head.
Now, one other thing is that I do want a firm plan for the employees coming forward on Tuesday. We've all had a chance to read what Lee has provided us and has asked for suggestions. So I want to be able to have a final plan on Tuesday so that the employees will know when they're back here on the 18th, here's what our guidelines are going to be.
18th or 27th?
27th, sorry.
Madam Chair, department heads have all seen this plan as well, I'm assuming.
Got the same copy you
Because
guys
I
got
would
this
like
morning.
any department heads to share concerns that you may have with
Absolutely.
us between now and Tuesday, so we can make any modifications, so.
Yeah.
You just seen it today?
Just not today.
Really?
So I'd
Oh,
like-
Are you talking about the
The 10
COVID-19 preparedness plan? The updated one, yeah, but there was a personal protection plan, or
Face covering policy.
face covering policy that's been out for, a suggested one that's been out.
The one from Tom?
The Tom Kelly way.
Yeah, I don't know that they've seen the
One that
drafted
Tom-
one.
Huh?
Tom's one's that sent around. I don't know that the one that we had at
Yours
workshop
did
went
not.
around.
Yeah,
Oh, you never sent that out. I just assumed he did.
That's not in here.
it's not in here, no, and that was kind of the idea behind it is, and I believe what the face covering one was based on previous discussions, that it was a strong suggestion that you encourage your employees to wear a face mask and we're asking that you respect the wishes of your coworkers. We're not deeming it as a mandatory. It's just strongly suggested is what our policy is going to read.
Correct. It was a voluntary but strongly encouraged.
Yep.
Based on,
So I think it's just difficult for departments to plan in the absence of the information. So I think we're kind of acting in tandem, this is what I'm thinking, and now seeing and hearing about what the plans are. I hope the window between now and Tuesday is enough to kind of bring those two things together.
That's,
Yeah.
Lee, can you get out that draft
Okay.
one to all the department heads so they can at least look at it?
This is pretty basic.
All right.
There's a lot of things that I would probably need to address still.
So we're tabling May 5th minutes until Tuesday's board meeting. Is there anything else that needs to come before the board? I think we've hashed it out quite well.
Yeah, that's for sure.
All right, with lots of emotion.
Madam Chair,
Yes.
this is Mark over at the Parks and Rec.
Hi, Mark.
office. Could you just repeat the approved motion so that we're all 100% clear on the action being taken?
Yes, on May 27th, we will be opening up the public windows that have not been opened yet, with the exception of DMV, and we're looking at a target date of May 4th.
June 4th.
I'm sorry, June 4th, right, May 4th gone. June 4th to get the outside drive-up window ready. We just want to make sure that that's ready to go. And we're asking the public to make appointments with the departments.
Well, Madam Chair, more than asking them, is this going to be by appointment only?
Well, by appointment.
Thank you, Madam Chair.
Yep.
I wanted to make sure it was opening for sure on May 27th.
Yep. So, thank you. All right. Matthew?
I just got word from one of the software vendors that it's got to be between 2 and 4 on Monday. So we're going to move the meeting for everybody who wants to look at the scheduling software.
Okay.
And I'll send out an invite.
Okay.
Oh, good.
All department heads.
Yep.
Good. Send it to commissioners too?
Yeah.
Good, thanks.
All right. If there's no other business about COVID, we are adjourned at